Hello, it's Bruce Williams again. Today I'd like to give you part 3 of a multi-lecture series on the pathology of the domestic ferret. And part 2 covered the anterior part of the GI tract, which was the oral cavity through the stomach. Part 3 is going to delve into the small intestine out until daylight, and we'll finish with some neoplasms of the GI tract in the ferret. As I do with all of my lectures, I'll always start by thanking my colleagues and friends who have provided me images over the years which have allowed me to compile these lectures for you. In 1993, I was lucky enough to be located within 10 miles of the epicenter of an outbreak of rapidly spreading diarrhea, which took out ferrets in facilities all across the country, eventually across the world. The first descriptions of this condition were that young ferrets would come into a facility with 100 or more animals, usually rescues, and a rapidly spreading, greenish, profuse, almost explosive diarrhea would spread through every animal in the facility within a matter of days. It didn't kill animals, except for the very young and the very old with other illnesses, but it did make them sick. And the picture here is very representative of what people are seeing, a greenish mucousy diarrhea. Initially named X disease, it eventually became known as the green slime because of the high mucus content. The greenish coloration is nothing special. It simply means that feces is passing through the GI tract too quickly for the normal breakdown products of red blood cells, which ultimately turn brown to get to that stage. So it was being excreted in an intermediate form, in this sort of greenish coloration. Well, after taking a number of samples, we were able to isolate a coronavirus from this particular outbreak and from other outbreaks within the region. And coronaviruses are well known for their transmissibility and their explosive nature. So it fit with this, and it fit with a previously identified syndrome, which was called Episodic Gastritis in mink. So this disease, which was caused by a group A coronavirus, was called Episodic Gastroenteritis, and eventually became known as Enteric Coronavirus, or ECEs. Well, we've seen ECE across the country. We don't see a lot of outbreaks anymore because almost every animal has been either exposed to it, born with it, or got antibodies from the mother. We've seen outbreaks in other countries, and a recent paper in Japan noted that 89% of all tested ferrets were positive for antibodies to the coronavirus that causes ECE. And it's expected the same is going on in other parts of the world, including the US, Australia, and Europe, where for a short period in the mid-90s and early 2000s, we saw this disease sweep across and infect just about every naive ferret. This is one of the first experimentally infected animals. You can see that this particular animal doesn't have a whole lot of body fat, and that there is a very green, Kelly green color to the feces, which it was passing out. You know, the initial characterization of the feces tends to be a little bit liquidy, but it quickly passes into a mucus phase, which is why people called it the green slime. This is not specific for this particular coronavirus. Just realize that the first cells that regenerate and repopulate the GI tract from the small intestine all the way down to the rectum are going to be mucus cells. They seem to be the first ones that are replaced. And so as the gut regenerates in any type of severe enteritis, you will often see a very mucousy character to the initial feces. A lot of wonderful work was done with this virus by Dr. Matty Kupel of Michigan State University, and here is a picture that he sent me from one of his control animals on top and one of the infected animals on the bottom. And you can see a number of differences between the two tissues, with the control tissue being fairly healthy, with well-digested feces within the lumen, and this section of jejunum on the bottom is really congested and red-looking. And when you look at the feces, you see that they have a very characteristic birdseed appearance with little round granules of undigested fat and protein. And people identified this very readily as a second stage after the mucousy feces were passed. Then there would be a period of time where you would get these birdseed-like stools. Once again, not specific for coronavirus infection, but you can see this with any condition affecting the gut, which results in maldigestion and malabsorption. And we'll explain that in just a minute. Here's a normal jejunum of a young, healthy ferret. And look how long and lush the villi are. And there's a tremendous amount of surface on them, not only for digestion, because the apical enterocytes of the intestine contain a number of digestive enzymes, but also a large amount of area for the partially digested food to be absorbed across the mucosa and passed down into the bloodstream. So, surface for digestion and surface for absorption. In animals that are acutely infected with coronavirus, and this is not specific to ferrets, but it's pretty much across just about any animal that has an enteric coronavirus, such as pigs with TGE or dogs with canine coronavirus. The coronavirus itself, like a number of other viruses, prefers to infect only the enterocytes at the velar tips. And these villi will become denuded. It doesn't touch the crypts at all, which is one of the reasons why you have a very high survival rate with coronaviruses. Whereas in other viruses which attack the crypts, like parvovirus, the mortality goes way up. As long as you have crypts, you can regenerate your velar enterocytes, because that's where they come from. Okay, so to get back to the coronavirus, it affects the enterocytes of the velar tips, causing necrosis and loss of them. And ultimately, these villi, which are now denuded, will fall together. And the body, in its rush to re-epithelialize these villi, will give one layer of epithelium that will cover several villi. And this is known as a process known as vilar fusion. Initially, when you lose the cells on the velar tips, the villi actually will contract and shrink down, because all a villus really wants out of life is to be covered by epithelium. So they shrink down, and it makes it easier for the body to cover them, but they also fall together. So what we end up with are villi. Instead of having 5 or 6 villi, we have one long, thick one. You can see here where the sides of these two villi never get covered by epithelium. They are entrapped, and you have a small pseudocyst or crypt abscess formulated. In this fashion, animals infected with coronavirus may lose up to 90% of the surface area for digestion and absorption in their GI tract, which causes a prolific diarrhea until this lesion is repaired. This particular lesion may be seen up to 8 months after infection of ferrets with coronavirus. The acute lesion, the very acute lesion, is once again nonspecific. Coronavirus infection causes a vacuolar degeneration of these cells at the velar tip. They become vacuolated, pycnotic nuclei, and then they will slough into the lumen, and that villus will begin to shrink down so it can be re-epithelialized by enterocytes moving up from the velar crypts. This particular lesion can also be seen in rotavirus. The main difference between rotavirus infection and coronavirus infection is generally in the age of affected animals. Kits less than 2 weeks of age are affected by rotavirus, whereas kits of all ages, even adult or mature animals, are affected with coronavirus. A wonderful study by Matty Kupel demonstrated the location of the coronavirus by labeling it with antibody, and you can see that there's nothing going on down here in the crypts. All of the virally infected cells are up along the villus, and this is a good thing for infected animals because it means that they will eventually recover from this particular infection. Dr. Kupel also was able to identify the presence of viral particles within the smooth endoplasmic reticulum or lysosomes of infected columnar epithelial cells from the small intestine. You generally have to catch animals that are infected within the first couple of days to see these. They tend to disappear fairly readily, although the animals will be able to be, these cells will be labeled for viral antigen, not particles, but antigens, up to several weeks out. If you take a little bit of feces from an acutely infected animal and look at it under the microscope, you will see the very characteristic appearance of coronavirus particles, which are various sizes. Some may be a little bit oblong, but one of the characteristics is they all have this corona, which is where they get their name, of peplomers. And this is fairly unique in the viral world and easily picked up. But once again, you have to get the animals that are acutely infected to be able to demonstrate this under scanning electron microscopy. And you can only see these peplomers in fecal preparations where they are in negative relief. Note that when you look at the viral particles on transmission EM, they don't show up. Well, there was a great experience working with these animals, doing the experimental work and identifying the agent, and working with Dr. Kupel and his group to come up and work out the pathogenesis of this lesion. This is not the last we're going to talk about ferret enteric coronavirus. But suffice it to say that every ferret that you ever encounter probably has been exposed to ferret enteric coronavirus. A number may be carrying it as latent carriers. And we have another story we're going to talk about in a later lecture about the ferret enteric coronavirus. Let's talk about other enteric diseases of ferrets. Did not see these until about 15 years ago when veterinary medicine took a significant advance, and the use of endoscopic biopsies made us aware of a growing number of cases of inflammatory bowel disease. I don't remember seeing any of these in the first 10 years of my practice, starting around 1992. But in the late 90s and the early 2000s, they became extremely common. And inflammatory bowel disease is one of the most common surgical biopsies that we see in ferrets today. It is usually seen in middle-aged and older ferrets. And we see this characteristic bird seed stool. Remember, we talked about it with enteric coronavirus, and you see this bird seed stool with little undigested bits of fat and protein, because these animals have a compromised GI tract, and the villi, once again, are shrunken, inflamed, and are not doing their digestive and absorptive functions properly. Inflammatory bowel disease is a complicated picture in all species that have it. There are quite a number of different causes in man, and we see it in cats, and it's fairly common in ferrets. And it's probably a complex of genetic predisposition, dietary factors, and possibly even commensal organisms living in the gut as well. One of the big problems in ferrets is that these are obligate carnivores. They have a short GI tract with a GI transit time of only 4 hours. They are obligate carnivores, so they eat a lot of protein. They do, in the wild state, take normal prey, and they get a lot of their vegetable proteins from whatever is in the prey's stomach at the time, the prey usually being rodents and having grasses, seeds, etc. Well, we've taken these obligate carnivores, and for the convenience of keeping them indoors, we put them on a largely kibble diet, initially vegetable-based, and we've migrated away from that over the last number of years. But most of the animal protein that is used in what we feed ferrets is not normal to the ferret. It's mostly chicken-based. And what ferret practitioners and pathologists have noted over the years is that we have this ever-increasing level of inflammatory bowel disease, primarily on animals that are eating these chicken-based diets. And one of the most important tenets of treating this is to get them away from the chicken-based diet onto something that is a little more natural. And rabbit seems to be very helpful for this. Even the denatured chicken protein diets tend to help affected animals, along with a little bit of steroids. And I'm going to talk a lot about steroids in the remainder of the presentation, because ferrets have developed a lot of immune-mediated disease, and it's thought that this is probably one of them. Ferrets are a fairly prednisone-resistant species, and we use prednisone much more readily in ferrets than we do in other species because they can handle it, and because of the amount of immune-mediated disease that we see in these animals today. But let's get back to inflammatory bowel disease. I try to keep my diagnoses very simple. I look for the characteristic villar blunting or shortening and fusion that I will see. Obviously, we've had a lot of loss of the villi here. There's extensive fibrosis in this long-standing case of the mucosa itself. And if you look very closely, you will see that within the mucosal epithelium that's lining these villi. Let's ignore all of this. This is the lamina propria, and I don't like to count inflammatory cells in the lamina propria. But you can see that the mucosa is infiltrated by large numbers of lymphocytes, which normally should be within the mucosal epithelium in fairly small numbers. This one, each mucosal epithelial cell is surrounded by several lymphocytes. Okay, there is a continuum, obviously, as we've seen in cats, between inflammatory bowel disease and a sequela, which may arise in areas of severe inflammation, lymphoma. But this animal is probably, to my mind, still in the realm of inflammatory bowel disease. And I'm going to recommend dietary changes and a little bit of immunosuppression to help him. Inflammatory bowel disease doesn't kill a lot of animals, but like Helicobacter, like coronavirus, it may contribute to poor thrift, a decreased quality of life, and obviously owners would like to get the stools of their animals back to a more normal basis. Now, there is another form of inflammatory bowel disease that primarily hits younger, often male ferrets, in which the effector cell is not the lymphocyte, but it is the eosinophil. And eosinophils are cells that generally are seen in hypersensitivity conditions or parasitic conditions, and parasites have never been identified in cases. But this was initially identified by Dr. Jim Fox and his group in the early 90s at MIT, and because the fact that the affected animals had inflammation of the GI tract by eosinophils, it went by the name Eosinophilic Gastroenteritis. As we found out subsequently, that's probably a misnomer, because many of these animals will develop infiltrates of eosinophils in a number of other organs and organ systems. Here we have it in the lymph node, and when you get a tremendous number of eosinophils together, you often get this aggregate of major basic protein, which causes these bright pink conglomerations of granules. in this lymph node that's infiltrated by large numbers of eosinophils, which themselves have these eosinophilic granules. In an animal with eosinophilic gastroenteritis, you can see eosinophils in large numbers in almost any organ, including the lungs or the skeletal muscle or the heart. And I've diagnosed a number of cases simply by noting the high levels of eosinophils in the circulating blood, where they may be up to 50% of the white cells within the blood. So you get a biopsy for an adrenal gland or an insulinoma, and you look in the vessels, and there's so many eosinophils, and you can come back and say, do you know your animal also has eosinophilic gastroenteritis? A little bit more about this condition. This is much more damaging to the gut and obviously other organs, because eosinophils have a number of very damaging compounds that they will release upon degranulation, much more than lymphocytes. And so these animals need to be heavily immunosuppressed for a lifetime, because this condition will wax and wane and recrudesce over a lifetime and can cause significant illness. So there are two types of inflammatory bowel disease: the lymphocytic form, which is more common, the eosinophilic form, which is less common but more damaging. And you should be on the alert for both of them, because they are not uncommon in surgical biopsies. Another condition first identified by Dr. Fox's group at MIT in the early 90s is a condition which is known as proliferative colitis in ferrets, and is caused by a bacterium that causes enteric disease in a number of species, where it primarily affects the ileum. The ferret is the only one that can be infected by Lawsonia intracellularly in the colon, and that's what makes it a little bit different. In other infected species, including hamsters, pigs, horses, and rabbits, infection almost always occurs in the ileum. It is a disease of, once again, young male ferrets. I don't know why young male ferrets tend to be overrepresented in these enteric diseases. But normally you should be able to read your newspaper through the wall of the colon. And you can see that this particular colon is much thicker than that, sort of thrown into folds. And the animal, upon palpation of the caudal abdomen, will be fairly painful. This great picture from Dr. John King's collection shows the normal colon up here at the right, which is fairly thin, and then you start to see these folds or glandular proliferations of colonic mucosa, which is growing out of control. And in the affected areas, you see a profound reddening, and there will be hemorrhage from small bleeding sites. Not one big bleeder, but a lot of small bleeding sites, as if the mucosa just becomes very leaky. When these animals defecate, it is poorly formed. There is often blood. They will vocalize during defecation, and defecation is frequent, as often as every 15 to 20 minutes. The histologic lesion associated with proliferative colitis is an unbridled proliferation of immature colonic epithelium. We have a nice mix here of somewhat mature colonic epithelium, which has a lot of mucus, because a major function of the mucosa in the colon is not only to absorb some water from the fecal mass, but also to lubricate its passage. And this is why we have a lot of mucus cells. But the presence of the bacteria causes proliferation of this immature, as well as epithelium that doesn't have any mucus, as well as a pretty profound inflammatory response as well. Lawsonia intracellularly is not difficult to identify. A silver stain on these proliferating immature colonic epithelial cells will demonstrate the characteristic gull wing shaped bacterium in the apical cytoplasm of infected cells. Unlike Helicobacter, which lives in the overlying mucus, these bacteria live in the apical cytoplasm of the cell, which makes it much easier for us to treat. And although I generally don't recommend the use of chloramphenicol for anything, and it is banned from any animal that produces meat or milk because of its ill effects in humans, we don't have to worry about that with our pet ferrets, and it can be used extremely effectively to clear these infections. If you don't have access to chloramphenicol in your own practice, you may want to contact somebody that does a lot of birds or avian species, because they usually keep it handy. Okay, so that's Lawsonia infection in ferrets. Other GI parasites, we don't see a lot of them in ferrets. Ferrets I consider indoor animals. They're either inside or they're in the laboratory, so they don't get out to pick up a lot of parasites. You can see that in parts of the country or countries in which they're kept outdoors, such as Australia, sometimes in Appalachia in the U.S. where they're used for hunting, but most animals are indoors, so we just don't have the exposure. One of the things that you can see in ferrets and other domestic pets that I think gets a bad rap is Giardia. Giardia is a very common commensal in ferrets and dogs, and usually causes absolutely no problem. When ferrets break with diarrhea, though, you can see these protozoans in fecal smears, direct smears, because of the characteristic way that they move. And I think we treat animals for this unnecessarily, but if you don't have any other cause for diarrhea, that's why a lot of them get treated. Very characteristic. They sit on top of the GI tract. They have a little sucker plate, but they don't damage the enterocytes at all. And here's one that you can see with the two characteristic quote-unquote eyes that they have. Not difficult to identify in normal ferrets as well, with perfectly normal stools. We're looking at the biopsy of intestine, and I routinely get calls every year that we have a new outbreak of a mutant form of Enteric Coronavirus. And I always take those with a grain of salt, because the days of disease associated with ferret Enteric Coronavirus are largely past. It's tough to find naive animals who haven't been exposed to it. So, but the story is always the same. It is a rapidly developing case of diarrhea in a rescue facility, which goes from cage to cage to cage to cage, resulting in a greenish, profuse diarrhea. And if you look at the lesion, we do have significant villar blunting here. We have fibrosis at the base of the villi. There are more lymphocytes in the mucosal epithelium that I like to see. The whole thing looks a little bit moth-eaten. And back in the day, 20 years ago, I might think, oh, this is an animal that's recovering from coronavirus. Okay. But the ultimate cause of this, when you get the right biopsy, is always the same. It is coccidia. Coccidia is still prevalent in ferret communities, especially rescue operations. And what generally happens is you have an infected animal, a group of infected animal in the first cage, and the owner of the facility comes in, or one of the volunteers, and is going to clean the cages. So they take all the ferrets out and let them run around on the floor, and they take their bucket of soap and water and clean everything really nicely, put the ferrets back in, go to the next cage, take the ferrets out, put them on the floor, take the exact same bucket of soap and water, which is now contaminated with the coccidia from an animal in the first cage, and they go down the line spreading the coccidia. And so quickly every animal is exposed in the facility to coccidia. If you take a look at the villus here, you can see that almost every enterocyte has either a coccidial schizont or a gamete, this being a microgamete here, and here is actually a macrogamete. And these, when the schizonts rupture, they rupture in a very synchronized form. So all of these cells will rupture the merons will go on possibly to have one more cycle within the GI tract before they develop into oocysts. Oocysts being the infective form which is passed in the gut and can sit in the soil until another ferret will ingest it, and the cycle starts again. When you have this type of synchronization, you can have denudation of villi, which will react very stereotypically and shrink down until they can be reepithelialized, giving us that very nice coronavirus-looking lesion. Now, coccidia doesn't cause a lot of mortality. Maybe the very young animals or the very old animals with other problems like insulinoma may succumb to this dehydrating, diarrhea, and enteritis. But in the most part, the animals respond very well to coccidiostats, and these outbreaks can be cleaned up fairly readily. Ferrets have 3 types of coccidia, 2 Eimeria, and 1 Isospora, which essentially act all in the same fashion. Great picture from Matty Kupel of young ferret kits between the ages of 1 and 2 weeks. You can see that the intestine is full of milk, but the milk is not being digested. This reminds me we have 3 kits, and we have 3 types of rotavirus. Rotavirus A, B, and C, which will affect the intestines of kits up to about 2 weeks of age. After that, we don't see rotavirus much anymore. It's a very common finding in animals of this age, especially from some of the major producers. So you usually will not see ferret kits of this age. Don't be surprised if you do isolate rotavirus from animals that are autopsied at a very young age. Oh, here's one of my ferrets, and this is a time that we're going to talk about gastrointestinal foreign bodies. This was Oscar, and Oscar had a habit of getting into everything. And remember, I told you that ferrets will investigate their environment with their mouths. Very curious animals, and they do like to chew on certain things if they are available to them. People who own ferrets have to go through a fairly thorough ferret proofing of their houses to prevent blockages. And Oscar's thing was plastic bags, rustly plastic bags. And he had to have surgery 4 times during the course of his lifetime because he would chew up these bags and swallow them. And it's not something that you can pass. It's a soft foreign body which just tends to get caught. And it never really moves through. The animals are able to pass feces around them, but we would know when he got into it. Other things that you will see fairly commonly. Well, this one didn't end up too well for this particular ferret. This is one of those rubber door stoppers that are right at the ferret's eye line, down at the base of the door, and when you wiggle that spring, it makes a great noise. And ferrets, one of the things that they love to eat is latex rubber. You never want to get latex toys for ferrets because they're going to tear off small pieces and they're going to eat them. Rubber bands. Okay, rubber bands are very common. Once again, something that's rubber. Not a good choice for a ferret. Now let's go back to, I think in the last lecture we talked about salivary mucoceles, and I showed you a picture of a ferret with a drain in its head. And that particular ferret, it was very difficult. The drains kept disappearing, and over again. And it was sort of interesting because they would never find the drains. Turns out that the other ferret in the cage would get blocked, and when they open it up, look what ended up in there. All of the drains from the ferret cage mate's mucocele. The ferret would find those interesting and eat them. So anything latex rubber is going to end up in the GI tract of a ferret. No, ferrets don't eat quarters. I just use this as a size marker. But here we have 3 structures which amazingly are the exact same size and shape of a ferret's stomach. And these are actually hairballs. And ferrets will lose a lot of hair, especially ferrets with adrenal disease may end up with hairballs, and they're not easy to diagnose. Sort of like rabbits, you don't see them until they almost fill the entire GI tract. You notice that the animal's not eating much, is losing weight, and then contrast studies will demonstrate the presence of a large hairball within the stomach. Some other incidental things that you will see in ferrets. We looked at this particular ferret. We looked at the broken teeth in Lecture 2. In Lecture 3, I want to tell you what happened. They always investigate their environment with their mouth, and they'll get all sorts of stuff stuck. And this animal had a large piece of wood stuck between the molars and the upper arcade, and when we peeled that off, there was a oronasal fistula, or a large hole underneath this. Luckily, this had blocked it, so the animal didn't show a lot of issues with it, and how it lived with this in its mouth, I have no idea. But oronasal fistulas can result from animals with long-standing foreign bodies. Here's another oral nasal fistula right here, and you can look right up into the nasal cavity. Okay, and if you also notice, this animal only has half a tongue. Well, this ferret was investigating its environment with its mouth, and it ended up biting an electrical cord, causing a tremendous burn on top and traumatically amputating, but also cauterizing its tongue at the same time. Don't feel bad for this one. This animal went to Dr. Avery Bennett at the University of Florida, who did a number of surgeries to put a flap over here, and actually did very, very well, and went on to live a nice, long, happy life. We have no feral or wild populations of domestic ferrets, Mustela putorius fero, in the United States, but they have them in New Zealand, the only place that they've been able to take off and live on their own. In this country, the animals are so domesticated, you let them out, and they often get out on their own. They probably just starve to death. But ferrets in New Zealand have been able to adapt to a wild life, and one of the problems that they get blamed for, I don't know if unnecessarily, but probably more than they should, is the fact that they can be infected with Mycobacterium bovis. Mycobacterium bovis is a problem in cattle, and they are considered one of the reservoirs for Mycobacterium in New Zealand, which doesn't make farmers very happy, and they have a very tenuous relationship at best with farmers. So here we see the very characteristic, I gotta get back to that slide. Here we see the very characteristic white raised granulomas associated with Mycobacterium in ferrets. I primarily in this country have seen various forms of Mycobacterium avium, which have all been reclassified. We'll talk about those a little later on. But mycobacteriosis causes a granulomatous hepatitis and splenitis, and you can see granulomas in many other organs as well. Here's a young Siberian polecat cross. This was half black-footed ferret, half Siberian polecat, which was being raised at the National Zoo back in the mid-90s. And they still are. The National Zoo does raise a number of black-footed ferrets, one of the most endangered mammals on this planet. And there was an outbreak of clostridiosis, which resulted in gastric bloat and a necrotizing gastritis. These animals were being fed at the time a bit of raw horse meat, which probably introduced Clostridium perfringens into their diet, and that's never a good thing. And then when they're stressed, you get overgrowth of the Clostridium. Here you can see in this gram stain, you can see the presence of the bacteria in the superficial lining of the stomach. All of this tissue that is not staining, this nice yellow and red, is all devitalized, necrotic mucosa due to the elaborations of toxins from Clostridium perfringens. And they've had a number of outbreaks over the years here. We haven't seen one in a long time now that we look for that particular agent. But that is Clostridium perfringens, associated with gastroenteritis in young ferrets. Something you'll see commonly in young ferrets is rectal prolapse. Usually it's seen because the animals have some form of diarrhea. The animals with profuse diarrhea, as the rectum contracts to push against the fecal mass, there's no fecal mass, and just pushes harder and harder, and eventually it will pop out through the anus, and you get this little rectal prolapse. You can see this in animals that are coming out of the major producers into pet stores or into people's homes where they've had a rapid change. They're used to one type of food and they get a separate type of food, and they get these a little bit of diarrhea and these rectal prolapse. You can also see it following coccidiosis in ferret kits. Don't see it very much in adult animals. And when I was in practice, I used to just put a little bit of preparation H and corticosteroids and pop them back in, and they rarely only need any type of surgical attention. Okay, let's finish this lecture with the neoplasms of the GI tract in the ferret. When we talk about the oral cavity, the vast majority of the neoplasms of the oral cavity, especially the jaws in ferrets, are squamous cell carcinomas, probably arising from the lining of the alveolus, which is the hole that the tooth sits in. You can always tell a bad tumor of the jaws because you have loss of teeth. Benign tumors tend to grow around the teeth. When the teeth fall out, that's almost always a form of malignancy. These are slow-growing, locally invasive tumors. They do tend to metastasize very late in the course of the disease, usually only go to the draining lymph nodes. Most of these animals will develop severe halitosis, and ultimately that tumor is going to burrow down through the bone of the jaw, resulting in a pathologic fracture and necessitating the animal's euthanasia. They don't seem to be responsive to very much in terms of radiation or chemotherapy, and usually they are too advanced at the time of presentation for surgical removal. Here's a section of intestine, and the most common neoplasm of the ferret gastrointestinal system, as it is with most of the systems, is lymphoma, the third most common malignancy overall, and we certainly see more than our fair share of it in the intestinal tract, because there's often, as we've talked before, a lot of inflammatory diseases that affect the GI tract, including Helicobacter, coronavirus, and inflammatory bowel disease, all of which ramp up the normal immune-mediated, or the immune system of the GI tract. And when you get it excited enough, eventually you may select for a clone of neoplastic cells. They all look alike, and they grow without any type of regulation. Did you know that over 50% of your lymphoid tissue is in your gut? And that's more than all of your lymph nodes combined. So a tremendous amount of lymphocytes and plasma cells in the gut, those lymphocytes just waiting for the opportunity to grow without regulation, to become a systemic problem or even cancer. The problem with lymphoma in the GI tract is that it's generally full thickness. It causes ulceration and loss of the overlying mucosa. You can see that this just fades out here. And this is probably simply a wall of lymphocytes. And when we lose the protective mucosal barrier, then we start to absorb toxins and bacteria directly from the gut into the bloodstream. And this is why the average survival time following diagnosis of intestinal lymphoma in ferrets is usually less than 2 weeks. The disease is advanced, and they are very prone to sepsis after diagnosis. Another not uncommon tumor of the GI tract in ferrets and other Mustelids, this is actually a skunk. But you can see that within the jejunum right here, there is a constriction, which is very white. It is drawn down, and this is an intestinal adenocarcinoma. And we see this, these are tumors of the epithelial lining of the intestine. As they grow, they tend to incite a tremendous amount of fibrous connective tissue, which over time will contract and shrink. And so they tend to result in blockages. You can see that the GI tract, the intestine proximal or toward the animal's mouth, is full of food that has been unable to pass this constriction, and the intestine posterior to the constriction is empty. If caught early, and obviously this one wasn't caught early, but if caught early, these carry a much better prognosis actually than the lymphomas, because you can excise this, and if you have healthy gut on either side, you can do an anastomosis. They do tend to metastasize fairly readily, so you need to do a careful exploration, make sure that they have not gone to the draining nodes, which would be a very adverse prognostic indicator. I think we're running out of tumors in the GI tract to talk about, but one that I've seen 5 or 6 times over my career is one that pops up around the anus. This is the anus of a ferret. It's very irritated. It is raw. And ferrets, like dogs and cats and obviously other mustelids, have paired anal sacs on either side of the anus. When a ferret is startled, it will express them. A condition known as poofing in the ferret ownership, and it's pretty malodorous, nothing like a skunk, but you can tell that they're cousins. And over the years, I've seen a number of tumors arise from the epithelial lining of these anal sacs, not from the glands. We do see that in dogs. The apocrine glands of the anal sacs will give some pretty nasty malignancies. But the squamous epithelium will give rise to squamous cell carcinoma. And you can see this is the normal squamous epithelium, and coming right off of the bottom of that, off the basal layer, are these very atypical squamous epithelial cells. And you can see that this particular neoplasm became fairly large. Here's the overlying perianal tissue. It's a very large neoplasm, necessitating the euthanasia of this animal. So they're uncommon. I've seen 4 or 5. Just to mention, mink will develop tumors of the apocrine glands as well as dogs, but I've never seen that one in a ferret yet. Okay, well, that brings us to the end of this lecture. We've covered the GI tract. That is, if you're working with ferrets, that is the one that you will see second most commonly. We still have to cover the endocrine, which will be a subsequent lecture where we see most of our cases from. But a lot going on in the GI tract, so these lectures have been a little longer than we'll do for the other systems. I appreciate you hanging in there. I hope you've enjoyed it, and I look forward to putting more ferret lectures out for you in the coming days. Y'all have a great day.